Okay, marketing is changing. What do I do for 2026? What's working? We're going to answer that today. Okay, Dan Brown here. I am the resident marketing specialist for MGE, and I'm back again with a tip. Now, this tip is a bit abbreviated. I've been told that I got to lighten things up and quicken things up. So I'm just going to go over some cursory points really briefly. If you want the full specifics, well, we got it covered in a podcast we just did, which is about an hour long. So a couple things. What's working and what should you be doing for 2026? So let's take a look at what's working and what's still working. There's a lot of rumor about AI and AI is taking over and this and that and the other thing, and you should stop all your conventional marketing. Definitely do not. I think AI's got a great place. I think there's great things coming. I just don't think we're there yet. Okay, so I don't suggest you do anything significant or abandon anything significant. And on that point, so what's been working? Google Ads. Google Ads definitely work. What I'm going to recommend is you do not do Google Ads yourself, and you do not do Google Ads with somebody who says, "Hi, I'm calling from Google to sign you up to get started with our, running ads." That person is not from Google. That person is positioning themselves from Google, and they are doing so dishonestly. They're authorized by Google, which takes like 15 minutes to get authorized by Google as a marketing agency. And they are giving forward the premise that they are with Google, and they are not. So they're starting the relationship with a lie. So I would avoid that like the plague. Another thing, if you try to do your own Google Ads, is it better than nothing? Not necessarily. It's a very complex set of circumstances that you need to be familiar with. 5-7 years ago, maybe. Today, find an authorized and proficient, proven specialist that can help you with that. Google Ads are expensive. We're going to talk about that and what's not working. You can under budget, and now you're getting no traction. Okay, what about SEO and organic search? Well, SEO and organic search just means not paid. So when people search dentist near me appearing at the top, should you use AI and is organic search engine optimization gone? Definitely not still. So you want to definitely rank at the top. You got to do things to do that. And you can't just rely on waiting for yourself with an SEO provider to get you to the top. So you'll do Google Ads until you are at the top. And when you are at the top, you're going to still do Google Ads. Okay, and before I go any further, I want you to hit the like button if you like this and subscribe so you get more tips like this in the future. Okay, and then what about once they find you through Google Ads or SEO or a referral or whatever? Well, they still need to see a great profile. That would be your Google Business Profile. Again, we go over a lot of those basics in the podcast. Okay, now what's not working? Well, it's not good enough now to do Google Ads with a super low budget. What's a super low budget? $200, $500, $700. And if you're in a very progressive and competitive area, it's probably going to be minimum of $2,000 a month after your team gets going with running ads for about 2 to 3 months. Anything that's set it and forget it marketing, you can't forget about it. You can't just turn your marketing over to a marketing company and they do everything. You're going to have to do the 20%. They're going to do the 80%, the heavy lifting and the technical. You've got to provide them with assets, testimonials, before and after photos. You've got to do social media posts, not have them do it. So 20% is still on you. You can't just be promoting specials. You've got to promote practice culture things, talk about your team, talk about your patients, all the things we talk about in the new patient workshop, links below on that one. Okay, so what do we do for 2026? Well, kind of the final takeaways on this is don't change much. Okay, I would say increase your Google Ads budget. Maybe if you want, explore a little bit of a higher budget or change marketing professionals, but don't abandon conventional marketing things. And the other thing I want you to think about is work on building the relationships with your patient, featuring your patients, featuring your team, more practice culture, build the relationship of trust with your patients. So when they go to your profiles, they really feel like they're walking in your practice. And then lastly, but probably most importantly of everything, is you're going to get people. You're going to get reaches, leads, people who want more information. They're going to ask, they're going to respond to your ads. You've got to follow up those lightning fast. And I mean seconds if possible, minutes if not, but hours you're already pushing it. And if you're not following up in the same day, that's money wasted, time wasted. Got it. It might be a weekend or after hours, but chase it up the first time you're back. I hope those tips help. That was as fast as I've ever done. Let me know if you like it fast or if you like it slow. We'll see you on the next one.